Brandon. So welcome everybody. So we're going to start with our service area today. So we serve 66,000 people in 26 communities. We have 122 hospital beds, 153 nursing home beds. CVMC owns and operates 18 practices. We have about 150 physicians, 1,500 employees, and approximately 200 volunteers. And CVMC encounters over 300,000 patients a year. And so we now have a short video from Judy Tartaglia, who is our CEO and president of CVMC.
Hello, my name is Judy Tarr. I'm the CEO of Central Vermont Medical Center. It's my pleasure to welcome you to our organization. Whether you're a new employee or a former employee, I'm delighted that you've chosen us as your employer.
Excuse me, please.
Yes, hi.
Oh, I'm sorry.
Oh, no problem. We're just doing a little filming.
Can you tell me where Mountain View is?
Absolutely. Follow me.
Thank you.
I'm going to share with you today our mission, our vision, and what we consider to be our key success factors for the future. You'll also learn about our governance structure, our board of trustees, our medical staff, and key administrators. So what do you think of this weather?
Oh, I think it's great.
Yeah.
What is it? Is it raining?
Oh, you're right about that. Well, here we are at Mountain View.
Oh, thank you very much for your help.
You're welcome.
It's nice to meet you.
Nice to meet you too, and have a wonderful day.
Thank
me
you.
get the door for you. Please let me know how I can help make your experience here a more enjoyable one. Thank you again for your service to our patients, our residents, and our community.
I'm Dr. Burns, and I'm one of the few remaining old-timers that was around when Central Vermont Hospital opened in 1968. It resulted from the combination of the Barre City Hospital and the Heaton Hospital. Barre City Hospital filled up in the 1960s and had to expand, but there was no real place to expand into because their lot was kind of small. Heaton gradually worked into a similar situation. Joel Walker, the administrator of Barre City, and Mary Chastany of Heaton Hospital got together, and he decided to combine hospitals. The result is a very excellent hospital where people still get personalized care.
The mission statement of Central Vermont Medical Center is to work collaboratively to meet the needs and improve the health of the residents of Central Vermont. Whether you work at the hospital, one of our medical practices, or at Woodridge, we are here to take care of patients and residents to the best of our ability. Our vision statement is the care you need from the people you trust. That means we provide medical care that the community needs from the people they trust, all of you.
I know from personal experience when I broke my foot that I received excellent care from the staff in the emergency department. I trusted that the cast they put on my foot was going to help me heal. I went straight from the emergency room back to my volunteer job in the gift shop.
Trusting is, and developing trust with a patient is really what it's all about in medicine, and it's really what it's all about at Central Vermont Medical Center. People work very hard to get to know the patient. They work very hard to meet their needs. They work very hard to not do something that would violate that trust.
What makes CVMC stand out are 5 key success factors. First and foremost are our extraordinary people. We have among the best, brightest, most experienced healthcare team in all of Vermont. CVMC is nothing but an empty building without its excellent workforce. You are what makes CVMC a great place to work. Second is our excellent reputation and image. Whether you are a nurse, a housekeeper, an accountant, a respiratory therapist, LNA, physician, occupational therapist, or administrator, you are key to making CVMC's image and reputation excellent in the community. Every patient or resident experience must be positive. This means that every encounter you have with our patients, residents, family members, or visitors needs to be upbeat, pleasant, and professional. Remember the care you need from the people you trust. Our third key success factor is our distinguished quality and breadth of services offered. We have an extensive system here of tracking and monitoring our quality indicators. We strive for ranking in the uppermost percentiles when comparing ourselves to other healthcare organizations. Quality is everyone's business. While you are employed here, look continuously for ways to improve your performance and the performance of CVMC. Our fourth key success factor is our financial strength. We must always keep an eye on that bottom line. We need to buy up-to-date equipment and technology. And we need to keep our facilities safe and clean. All of this takes money. We have to be good stewards of our resources. Last but not least, our final key success factor is that we remain a valuable community benefit. Remember why we exist: to meet the healthcare needs and improve the health of the residents of Central Vermont. It is our responsibility to assure that this organization remains a very valuable asset to our community. Central Vermont Medical Center is governed by a group of highly skilled and experienced volunteers who are called trustees. Trustees are community representatives who are responsible for governing the organization. These folks are ultimately responsible for what happens at CVMC. We have approximately 25 trustees who attend monthly meetings of the board. They listen to reports from the medical staff, quality, and finance committees. They ask questions and hold management accountable. Our trustees approve the budget annually and establish our strategic plan. The medical staff consists of over 150 physicians. We also have over 35 certified nurse midwives, physician assistants, and nurse practitioners. CVMC is considered a regional hospital, providing many specialty services such as cardiology, radiation oncology, gastroenterology, neurology, and many others. Our medical staff are highly skilled and trained. All of our physicians are board certified or board eligible. Our senior management team consists of 10 people who oversee operations, finance, quality, nursing, information systems, community relations, human resources, and medical affairs. These people report to me, and they are responsible for the day-to-day operations of the entire organization. Over time, you will get to know our senior management team. You should feel free to approach any one of them at any time with questions or concerns. Once again, welcome to CVMC. Work hard, always put our patients and residents first, but also it's okay to have a little fun.
Okay, so this is communication, cultural competence, and patient and family-centered care. To understand effective communication, cultural competence, patient and family-centered care, and why they are important. So why focus on communication and cultural competence? So a variety of patient populations experience decreased safety, poor health outcomes, and lower quality care based on race, ethnicity, language, disability, and sexual orientation. So it's essential to quality care and patient safety, ensure compliance with laws that support the issues of effective communication and cultural competence, required to meet the specific and unique needs of our patient populations. So what is effective communication? Patients and providers exchange information, enabling patients to participate actively in their care from admission through discharge, ensuring responsibilities of both patients and providers are understood. This is a two-way process. Patients comprehend accurate, timely, complete, and unambiguous messages from providers, enabling them to participate in their care. So what is cultural competence? So ability of healthcare providers and organizations to understand and respond effectively to the cultural and language needs of the patient. Requires organizations and providers to value diversity, assess themselves, manage the dynamics of difference, acquire and institutionalize cultural knowledge, adapt to diversity in the cultural context of individuals and communities. Okay, so what is patient and family-centered care? So this is an innovative approach to plan, deliver, and evaluate health care grounded in mutually beneficial partnerships among providers, patients, and families. So this applies to patients of all ages and practiced in any health care setting. So the diversity in the U.S., nearly 1 in 9 residents is foreign-born. 19.6% of the total population speak a language other than English at home. And these are some projections for 2050 for the U.S. Census Bureau. So federal law prohibits discrimination by federally funded entities based on race, color, and national origin. So federal law requirements, discrimination based on limited English proficient status. So denial of services or opportunity to participate in services, delay in delivery of services, or less effective services. Services that do not meet the standard of care, hospitals are required to provide language assistance services to the deaf and hard of hearing patients at no cost, includes physician offices owned by the hospital, as well as programs sponsored by the hospital. So this is the Disability Act of 1990. Public entities may not require an individual with a disability to bring another person to interpret, may not rely on someone accompanying the individual to interpret, may not rely on a minor child to interpret, and may not rely on untrained translators. So patient rights. So this is our policy A103, patient rights and responsibilities. So the purpose of this policy is to protect the rights of all patients as the organization provides care within its capacity, stated mission, and philosophy, as well as in compliance with the relevant laws and regulations, and to identify the responsibilities patients have during the receipt of health care services. So Central Vermont Medical Center realizes that respecting patient rights is an important aspect of care that encourages patients to become better informed and involved in their care. Care, treatment, and services should be provided in such a way that respects and fosters the patient's dignity, autonomy, positive self-regard, civil rights, and involvement in their own care. CVMC supports the patient's need to be informed of their rights, to understand and exercise these rights, to respect the patient's values, beliefs, and preferences, and to inform the patient of their responsibilities regarding their care, treatment, and services. So, as a patient of CVMC, you have the right to receive considerate and respectful care at all times and under all circumstances with recognition of your personal dignity, values, and beliefs, to know the name and profession of individuals providing your care, and to know the name of the physician who is responsible for your care, to participate in the decisions about your health and well-being, obtain complete and current information about your diagnosis, to have the right to leave the hospital even if your doctor advises against it, to be informed by the attending physician of any continuing health care requirements, provide written consent prior to recording or filming, to view and receive copies of your medical record within 1 week of completion of the documentation, to file a written or verbal complaint of grievance with CVMC regarding your care and treatment and have your grievance reviewed, to formulate advance directives and to expect that properly executed advance directives will be honored, to be informed of the care provided, including unexpected outcomes, to have information necessary to give informed consent prior to the start of any procedure or treatment, receive appropriate assessment and management of pain, to refuse treatment to the extent permitted by law, and to be informed of the medical consequences of the refusal, to have family members or other persons you choose participate in care decisions, to have an interpreter if a language barrier or hearing impairment presents a problem, be free from mental, physical, sexual, and verbal abuse, neglect, and exploitation. So what should a patient do if they have a concern? So the patient should notify their physician, nurse, or the quality management department. The patient can also file a written or verbal complaint or grievance with CVMC. As an alternative to voicing a complaint directly with CVMC, a patient or their family may direct the following organizations. So HR policies and benefits review. So we do have a 90-day orientation introductory period, and this can be extended by your supervisor. This is to allow department management time to determine if the employee will meet competency expectations of the position, and there is a performance evaluation that is conducted at the end of your 90-day orientation period. So our attendance policy. So CVMC requires employees to be at work on time on their scheduled work days and to properly notify their department manager when an absence, tardiness, or unanticipated departure occurs per their departmental notification process. Chronic issues with attendance will be addressed with corrective and disciplinary action per the attendance policy guidelines outlined in our policy. CVMC has set expectations for all employees regarding the number of allowed absences and tardy lateness within a rolling 3-month period. And please review these expectations with your manager. Personal appearance and dress. So appearance and attire affect the impressions that patients and visitors have of our facility. CVMC expects that employees be dressed appropriately. Clothing and jewelry should be neat, clean, and suitable for a professional business environment. And you do want to review your department-specific dress standards with your supervisor. So CVMC grievance policy. So this is a confidential process, and this is available to active employees who have passed the initial 90-day orientation. This is used to dispute a documented disciplinary action or application of a rule or policy after all attempts to solve the problem on an informal basis have failed. So your first step is going to go to your supervisor. Second step will be the department vice president. Third step would be the VP of HR. And then your final step would be Judy, our CVMC president. So now we're going to workplace harassment. So workplace harassment is any conduct initiated by a coworker, member of management or medical staff, patient, resident, or visitor that unreasonably interferes with an employee's work performance or results in a hostile work environment. So employees have the right to work in an environment that is free of harassment. It is unlawful and against CVMC policy to retaliate against any employee for filing a workplace harassment complaint, including sexual harassment. So the types of sexual harassment. So I think this is on your quiz. So quid pro quo sexual harassment, this means this for that or in exchange for. So an example of quid pro would be demanding sexual favors in exchange for a promotion or raise or some other employment benefit. A hostile work environment sexual harassment, the 4 most common types are verbal, physical, visual, and written. So the following behaviors can create a hostile work environment if they are unwanted or uninvited. So this can include off-color jokes or teasing, comments about body parts, suggestive pictures, posters, calendars, or cartoons, leering, stares, or gestures, repeated requests for dates, and any form of unwanted touching. So what is a sexual harassment incident? So an incident constitutes sexual harassment if it is unwelcome, focuses on sex, creates unreasonable interference with the individual's terms and conditions of employment, causes an intimidating, hostile, or offensive work environment. So definitions related to sexual harassment. So a derogatory comment, this is a comment that treats a person or a group in a negative way. Discrimination, treating others differently because of their race, sex, religion, national origin, color, disability, age, or any other protected category. Harassment, this may be verbal, physical, or visual based on race, sex, religion, national origin, color, disability, age, again, any other protected category. So the key concepts of sexual harassment, the key word is unwelcome. Any unwanted, unwelcome, or unsolicited sexual conduct that is imposed on a person who regards it as offensive or undesirable is sexual harassment. So an inappropriate use of power. The majority of people who harass do so as a way of expressing dominance or power. The employer and the non-employee. Sexual harassment can also occur from outside the organization by a visitor, patient, resident, contractor, etc. So how to prevent sexual harassment? So the best method to stop harassment is to prevent it from happening. Prevention begins with an attitude that sexual harassment in any form will not be tolerated. You want to conduct yourself in a professional manner, become familiar with your right to work in an environment free from discrimination based on sex, and be prepared to assert that right. Become acquainted with your organization's policy and procedures for reporting harassment. So how to handle sexual harassment. You want to be direct and candid with a person and remain professional. Say no clearly and inform the harasser that his or her intentions are unwanted. If the behavior continues, you want to contact your supervisor or the HR department to make a formal complaint. Refer to CVMC's workplace harassment policy to follow the procedure to file a complaint. So when reporting the harassment, be prepared to tell all the facts surrounding the incident, including date, time, place, and any witnesses. Be as thorough as possible with details, and remember your complaint is much stronger if made while the harassment is going on or shortly after it has ceased. And we now have a fun little video on sexual harassment for you guys to watch.
Hi, my name is Greg Naylor. As an attorney, I practice principally in the areas of labor and employment law, and I've defended several sexual harassment cases over the years. The United States Supreme Court has said that sexual harassment is a common problem that by now every employer should anticipate and stop. Preventing sexual harassment is really all about employee education, which is why you need to know what it is and what you can do about it. In the healthcare industry, federal law protects you and your fellow employees from sexual harassment. Even though the physical care offered in the healthcare environment makes your service different from many other businesses, the same laws still apply. Recently, there's been so much said about sexual harassment that it can be a little confusing. What exactly is it? How do I know if I might be harassing someone, or if someone is harassing me? Does it matter who the harasser is? And what can be done to stop harassment? In healthcare, sexual harassment issues can be very complex. Not only is staff protected from inappropriate actions by co-employees, but they are also protected from actions by third parties, such as vendors or even patients. In addition, unlike a business office or a manufacturing environment, clinical situations often require physical contact, which can be an especially sensitive issue. This video will present situations that you, the healthcare professional, should avoid to protect yourself and your facility from sexual harassment claims or other legal problems. The law on sexual harassment doesn't need to be complex. Over the years, the courts have generally identified two types of sexual harassment. The first type has been called quid pro quo. It's unwelcome sexual advances or requests for sexual favors by a supervisor in return for favorable job considerations, like raises or promotions, or avoiding unfavorable job consequences, like demotions or discharge. The second and most common type has been called hostile work environment harassment. Hostile work environment harassment is unwelcome words or actions based upon a person's sex which are severe and repetitive enough to create an abusive work environment. We're going to be showing you several brief case studies based upon true stories. In each example, the behavior illustrated is clearly wrong, but it may or may not be illegal sexual harassment. See if you can tell if it is or if it isn't. At the end of each example, we're going to be giving you a brief explanation of why it's either illegal sexual harassment or not, and what can be done about it.
You seen the patient in 412?
412.
Mm-hmm.
412. She yours?
I wish. Oh, you mean my patient, right? Yeah, she's mine, all right. You should see her charts.
I don't believe you two.
Oh, what's wrong, Rosa? You shouldn't be jealous. You got pretty nice charts yourself.
Although this man's words were not specifically sexual, what he said has sexual implications. According to the law, sexual innuendos in conversations that imply sexual meaning are just as unlawful as using direct sexual language. Usually one comment or action isn't considered harassment. Typically, illegal harassment is a pattern of repeated behaviors or words that interferes with a person's work. If these unwelcome comments continue, this example could become hostile work environment sexual harassment.
Dr. Fuller.
Oh, hi, Jim.
Nancy Maddie, your patient in 1213. I don't think her block is working. She says she's still in a lot of pain.
Well, don't worry, Jim. That sometimes happens with this type of surgery. We can increase the meds, and that should help if the block doesn't take. I'll look in on her.
Oh, thanks, Dr. Fuller.
Oh, please, you can call me Beverly. You know, Jim, I've been very impressed at how sensitive you are to patients' needs.
Well, thank you.
But you need to learn to relax a little, too, you know. Hey, I've got a great idea. Why don't we drive up to my lake house this weekend? Just the two of us. It'd be a fun getaway. You know, we could talk about that opening for surgical nurse that I told you about. You know, that position could be a great opportunity for you.
Potential problem? Possibly. When Dr. Fuller asked Jim out for the weekend, that request alone didn't violate any laws. A simple request for a date is not harassment. If a supervisor harasses an employee and there's a tangible adverse employment action, such as a demotion or a discharge, or where a promotion is tied to consent to the harassment, the organization will be automatically liable for the supervisor's harassing conduct. As such, the law clearly places a very heavy burden upon employers to educate, train, and warn all employees, particularly supervisors, to avoid harassing conduct.
Yeah, that should be ready in about an hour. Okay. We'll see you then. Long day.
Yeah, tell me about it.
You know, I have been meaning to tell you. I love what you've done with your hair.
Yeah, please don't do that.
Oh, come on. I'm just trying to pay you a compliment.
The courts have said that physical touching will more quickly create an illegal work environment than off-color comments or jokes. Physical contact in the workplace is clearly unprofessional. It's usually unwelcome, and it can often create a sexually harassing work environment. In this case, the woman clearly let the harasser know that she wanted him to stop touching her. Because he continued, this could be considered sexual harassment. The best policy for prevention of this kind of sexual harassment is really very simple. Unless you're doing a clinical procedure which requires physical contact, don't touch anybody at work. Physical contact in the workplace can be both unwelcome and misinterpreted. Let's take a look at another situation.
Liz, you might want to take a look in on 320. I think it's about time to check his IV.
Yes, I was just on my way.
A little something from the boys.
Thanks for the present, guys. Ooh, that's nice. Oh, now, Miss August, that's the girl in my dreams.
Yeah, and only in your dreams, too.
Oh, no, nurse, What do you think? Is she too good for me?
I really wouldn't know.
You wouldn't know.
Hey, Ray, show Miss July. Maybe she knows her.
Oh, yeah, hey. What do you think? Do you know her?
Hey, check this. What do you think? Right here?
Oh, yeah, right there.
This is your get well inspiration?
Oh, yeah, I'm feeling better.
Oh, yeah.
I really don't appreciate those kinds of pictures. Is there anything we can do about that?
Boys will be boys.
Here is a situation where 3 important points should be stressed. First, even though this patient and his friends were not employees or co-workers of the nurse, they still created a hostile and offensive work environment. The law is clear. Even the actions of third parties or non-employees can create a sexually hostile work environment. Your organization can be liable if it knew or should have known about the harassment and failed to stop it. This brings us to the second important point. The nurse's supervisor clearly observed the situation. Legally, the supervisor should have reacted and immediately stopped the harassment. Failure to act could be viewed as excusing or even encouraging the illegal behavior. And the final point. According to the law, the display of suggestive pictures, posters, calendars, or lewd cartoons can be just as illegal as offensive sexual comments. Facilities that allow such conduct could be liable for sexual harassment.
I guess I know my next stop.
Hey, Gene. You ever play Candy Striper and the Librarian?
Look, Bob, I think I've made it clear that I'm not interested. And I'd really appreciate it if you'd stop following me around like this every weekend.
Hey, lighten up. I just think volunteers should sort of stick together, especially you and me.
Here we have a situation where the parties involved are technically not employees of the hospital because they're both volunteers. Still, everyone has the right to be treated professionally and with respect at work. As volunteers, they are providing needed services for the employer. Even if they're not compensated, volunteers should still be able to work in a non-threatening environment. In this case, the man's requests had become repetitive, and his demands for a date were not welcomed by the woman. He was creating a hostile work environment. Even as a volunteer, she should follow her hospital's procedures and report the objectionable conduct.
You're kidding. So they checked out, and I never heard from them again.
Oh, I heard some great nurse jokes.
Oh, swell.
What's the nurse's mating call?
What?
Cha-ching, cha-ching. How do you know if a nurse is enjoying herself during sex?
Oh.
Beats me. If it ever happens, I'll let you know.
Oh, yeah, that's really funny.
What's wrong, Susan? Don't you get it?
That's not what I hear.
Oh, hey, I've got a lot more.
The courts have made it clear that isolated teasing or even simple rudeness is not sexual harassment. However, sexual jokes, off-color comments, and sexual acts can become illegal if they are severe, they're directed at a person because of their sex, and they negatively affect a person's employment. It is clear that these sexual jokes would have been offensive to a reasonable person, and they did offend this woman. However, the men continued telling the jokes such that they created an illegal hostile work environment.
Takes care of that. Well, I'll bet you're glad to finally get that cast off, aren't you?
No, that's for sure.
All right. Let me just reach in.
Hey, what do you think you're doing?
I'm sorry.
Is this sexual harassment? Probably not. It appeared that the physical contact, which the patient found disturbing, was truly unintentional and incidental to the healthcare procedure. Remember, in a healthcare setting, physical contact with patients or others is often not only unavoidable, it's part of the job. So how do you avoid an uncomfortable situation such as the one we've just seen? It's always a good idea to clearly explain to a patient what you're going to be doing during a procedure, particularly if there could be any physical contact. By doing so, the patient will be forewarned if any incidental contact does occur. By now, you should have a pretty good idea of what sexual harassment is, but you can see that in some situations, it really isn't always quite so clear. So how can you tell if what you're doing or saying is sexual harassment? Let me give you some simple rules to work by. If in doubt, don't say it. Don't imply it. Don't put it on display. Think about what you're about to do or say, and if there's any doubt at all, don't do it or say it. Now let's review the main points. First, sexual harassment is illegal. Under the law, every person has the right to work in an environment which is free from sexual harassment. The most common type of workplace harassment creates a hostile work environment where repeated verbal or physical actions are directed at another person because of the person's sex, and the conduct is unwelcome or unwanted. The harassing behavior must adversely affect the victim's employment by creating an abusive work environment. Some examples are suggestive or off-color jokes, comments about body parts or one's sex life, suggestive pictures, posters, or calendars, repeated requests for dates, and any inappropriate touching, including rubbing, pinches, or even repeatedly brushing up against someone. How can we stop harassment? Every employee should take proactive and preventative steps, such as learning and following your organization's policies. Remember, if you think you're being sexually harassed and it's interfering with your job, tell the person harassing you to stop. Further, if you observe sexually harassing conduct, don't walk away, report it. It's not only your right to work without being sexually harassed, but it's also your responsibility to help build a workplace free from this type of illegal behavior.
Welcome to CVMC. So I'm from your IS department, so I'll just kind of get talking a little bit. There's two different, we kind of break down IS in two different groups, the analyst and the techies. So the technical department takes care of the hardware, like the laptops, the PCs. And then the analyst, we take care of the software. So any issues with software, call us. So we're option number 2, and the techies are option 1. 4176 is our number. And just as I take a sec to log in, I'm going to log in and then pull up a quick little PowerPoint we have. So like I was saying, the system I'm logging into right now is called VDI. It's Virtual Desktop Infrastructure. And we're changing a little bit of our IT infrastructure here. We're going to, well, probably the best way to relate to it is sort of like a cloud system. Basically, everybody has their own type of computer. They log into the system, and the computer follows them where they go, whether you're going to the practices or you're going up to MedSurg or the ED here. I kind of started talking about this a little bit, but 4176 is our number. So there's two different options. The analysts, we help with the clinical side, and then the technical people, we call them the techies, they help with the PC, the laptops. So how you get computer access here, if you don't already have access, you want to contact your supervisor, and they will fill out a computer access form. We name it CAF, short for that. We don't want you to really share your password. You'll get a generic password given to you, and then you'll be prompted to change that. So we strongly recommend that you don't share your password at all. We use a network login here. So when you log in, you're going to be given a login name. After that, CAF form is come to us and given back to you, and your supervisor will help you with that. So some departments, I don't know how many of you guys are going on to the nursing floors, but in some departments we still use a generic login, and we need to update this list, but with VDI you won't be using a generic login anymore. I kind of talked about that a little bit. Everybody gets their own username and password, but there still are a few units and departments out there that do. So here's the VDI virtual desktop I was talking about. So currently we're live in the following units. So if any of you guys are going to DSCU, IPPP, cardiology, respiratory, and inpatient rehab, along with MedSurg, you will each have your own username and password. and you'll want to get a little bit further training on that as well. This is a really important message. If you're not in a VDI department, you will get prompted with this message. This is our semantic antivirus program. It's actually very easy to register, but you have to do this on every computer that you log into. It literally takes about 10 seconds. So you hit register now, and then you hit the next button. And then after the next button, you hit the next button, and then you just exit out at the bottom here. So this little X over here. Once you do that, you're registered with that computer. You won't encounter any problems like when you put a CD-ROM in or external drives and stuff like that. If you do not register, you're going to run into problems like that. So this is the CVMC route. It's broken down into two different types of folders. You have the shared folders and the work groups folders. The shared folders means everybody can view those folders throughout the hospital. The work groups is specific to your department. So that means if you're working in a department, for an example, and you're working on med-surg, and you go into the work groups folder under med-surg, only med-surg employees will be able to see those folders. This is a screenshot of Meditech, the login screen. This is where you put your user ID and password in. We want to kind of point out this little tag here because this is the device name. If you call IS and you can't find the device name, you want to open up Meditech like you're going to log in, stop right at this screen, reading left to right, you'll show date, time, and then right here that number is the name of your computer. We'll be able to log in and help you and assist you with your problem once you give us that. So here's one of those tags that are on the computer device. You want to look for that as well. That's the name of the computer. And then again, it says Meditech ID. Also, the IP address works as well. And for VDI computers, it's right on your desktop background. We made it very easy. All you got to do is just look at your desktop background, and you'll see right up here, IS11-V. That's the name of my computer. So how to access your email. If you're outside and you're not on a VDI computer, you can go to Favorites up here, open up Internet Explorer, go to Favorites, scroll right down and go to Outlook Web Access. It'll open up your email. Also from home at the bottom here, you can see mail.cvmc.org. That is going to be, you can access that anywhere across the country as long as you put that in your web browser. For CVMC page, if you guys aren't familiar with this, you can get this off the Favorites. So if you open up IE again, that's Internet Explorer, you can go to Favorites, CVMC Favorites, and then you can go Page, and it'll come up to this area. I like to use the directory here. So if you click on that, you can basically find everybody alphabetically by last name. For VDI, for getting your email, you just log into the computer and you launch this Outlook icon. This will open up all of your mail, and then hitting the X will close it out. So just going to talk a little bit about logging off. There's different ways to log off. So at night, we want you to log off, not restart your computer. So when you hit shutdown, you're presented with a couple different options on Windows XP. You can see log off and shut down and lock computer. We want you to log off at the end of the day. So you can simply, on here is showing you from the start menu, you can see you can hit log off. It's the second option off. So here's some quick tips about running into issues. Basically, I'm going to, instead of going through all this, if you run into any of these issues, you pretty much want to give us a call right away. The first one is definitely a technical issue, so option 1. And then the second one, again, is another technical issue. But things like if you encounter problems with your password for the software application you're using, like Meditech, maybe PySys, or eClinicalWorks, you want to do option 2, and SAMList will be able to help you. So lastly, I just want to touch base on audits. We do routine audits on everybody here. and it's random. And there's a record trail wherever you go. So if somebody, be careful because, you know, a lot of times we'll see people will leave their computer workstation up, and they'll say, oh, just use my session and just check into that patient. Well, if that person that had the session up wasn't assigned to that patient, and then you're just going in and accessing their charts, it goes under their name. And they might have not have meant that, but then it's on their audit trail. So we really want to be careful about where we go. We look at it a lot. So just wanted to mention that. Do you guys have any questions?
So we're going to get into workers' compensation and ergonomics. So this is a system of compensation for work-related injuries or death paid for by employer compensation insurance contributions. To prevent injuries by encouraging a safety-driven culture, employees are asked to look and think about what you are doing. You want to assess the risk and evaluate, follow safe practices, be aware of policies and adhere to them, and if you don't know, then ask. You want to use lifting and moving aids as needed. Look at your posture and body mechanics. Bend from knees, not from back. Assess the weight and get help. Waiting is better than hurting. You want to assess your workstation to ensure the setup suits you. Rotate tasks to avoid strain and get up from your desk. Stretch and take posture breaks as needed. You do want to check your posture during keyboard use. Avoid hyperextension and use sensible keyboarding skills, and we do have suggested exercises. Do not take unnecessary risks. Be safe. Follow CVMC and department-specific policies. Report any unsafe conditions. Look out for your own safety and the safety of others, and attend any appropriate department training. So you want to wear personal protective equipment when required and always use common sense. So what to do if you are injured? You need to report to your supervisor as soon as possible to complete an incident report. In the event of a needle stick injury or blood exposure, you need to report to the ER immediately. So employees are responsible for ensuring they are compliant with the following required immunizations, and all clinical staff must have documentation of the hepatitis B status. So hospital employees, you're going to park behind the hospital. It's called the north parking lot. So either entrance, you're just going to come around the building and park, and it says employee parking. That's called the north parking lot. It's right behind the cafeteria. Woodridge employees, you park along the back, and you'll notice when you drive down in, it's just further around the back that you're parked. And then physician practices have designated parking spots at the clinics. So the use of tobacco products anywhere in or on the property of CVMC is prohibited. Performance appraisals. So these are conducted at least annually for the purpose of assessing an employee's job-related performance, provide feedback, and improve performance. Evaluation is based on the primary duties of the position as well as behavior performance factors. So performance level from the annual evaluation will be used as the basis for approved salary adjustments. So depending upon financial conditions, salary increases are typically provided to eligible staff at the beginning of our fiscal year, which is in October. So flexible benefits. So Wilma, who is our compensation and benefits analyst in HR, is going to be coming in to go over all the benefits with you. So I'm just going to call her.
Well, good morning. My name is Wilma Duke. I work in human resources. I work primarily with the benefits. And the first thing I'm going to do this morning before we jump into talking about our flexible benefits plan is just give you some information about our retirement plan here. CVMC provides a 403B retirement plan. It's similar to a 401K, but because we're a nonprofit organization, it's called a 403B, and that's how you'll come to hear it referred to. The booklets are pretty self-explanatory. They talk about the automatic enrollment feature, and that's probably the most important thing you need to know. If you do not make a phone call or go online to enroll in this plan, you'll be automatically enrolled. If you don't want to be automatically enrolled at 1% salary deferral, then you do need to make sure you go online or call them to opt out of the plan. Every employee, even per diem employees, are eligible to participate in this plan. You will have an opportunity to make salary deferrals. It's all your own money going into the plan initially. Once you've met eligibility, which means once you've completed 1,000 hours in your first employment year, you'll become eligible for an employer-based contribution, which is currently 3%, and CVMC is also doing a matching contribution of up to 3%. So just important to know that, you know, initially when you sign on, it's all your own money going into the plan. After you meet eligibility, if you meet eligibility, you'll be eligible for employer contributions as well, okay? And the booklet explains everything to you about the automatic enrollment. It explains to you how to go online or make a phone call to participate. Talks about the vesting, the contributions, how they're allocated based on, you know, your particular choices that you make. So I just want to make sure you folks have that information. If you have any questions, please feel free to call me. My phone number is provided in your benefit packets. For those of you who are not eligible for the Flex Benefits Plan, you might not have my information, but you can certainly contact me in Human Resources, okay? You will not be able to contact the group Diversified or Transamerica, which is the retirement plan administrators. You won't be able to contact them until after you've received your first paycheck, because that's the way that the information about you gets loaded into the system, and that's how they'll be able to identify you as a new participant, okay, is when the payroll file is transferred to them. So just hold off until you receive your first paycheck before you try to enroll or make any changes with this plan, okay? So the next thing, now that we've talked about the 403B plan, we're going to talk about the Flex Benefits Plan. And those of you who are eligible for our Flex Benefits Plan have been provided a packet that includes an instruction letter, a workbook, and some various materials about the individual plans. The packet of information is probably very detailed and a lot more information than what we're going to go through on the slides. But the slides will provide you with a brief overview. I'm also available to meet with folks individually if you have specific benefit questions that you want to talk about, or if this is your first time having any benefit programs available to you, or if you just feel that you're not comfortable doing an online enrollment. I'm happy to sit down with you and help you with that. The instruction letter in your packet explains how you go online to do this enrollment, okay? And similar to, you know, what I just explained about the 403B plan, our third-party administrator, Crosby Benefit Systems, needs to have information about you in their system before you can perform your online open enrollment, okay? So give it about 10 days, okay? They have a 10-day service agreement with us. They're usually faster than that. I would expect that you could go online and do your benefit enrollment by Friday, but you certainly won't be able to sign on later today or tomorrow to do that, okay? So look your materials over and kind of get a feel for, you know, what the benefits are all about before you sit down to do your enrollment online, okay? Those of you who are being hired today will become eligible for benefits the 1st of September. You do need to satisfy 1 month of employment, and then benefits take effect the 1st of the following month. So September 1st is your benefit effective date. Okay? And I'll just get started going through the slides. If you do have specific questions and you want to interrupt me, feel free. Or as I said, if you really feel that you have specific questions you'd like to discuss with me one-on-one, we can set up time to do that later on. So our Flex Benefit Program is provided to full-time and part-time employees who are scheduled to work at least 40 hours per pay period. This is a Section 125 cafeteria plan. The contributions you make for your benefits are pre-tax contributions. The plan includes options for medical, dental, vision, disability insurance, life insurance, and spending accounts. You become eligible the 1st of the month following 1 full month of employment at 40 hours or more bi-weekly. Your benefits can be changed during open enrollment or at the time of an IRS recognized status change. Deductions are withheld 26 times per year, and we do provide online enrollment. Now, a piece of information about this open enrollment, our fiscal year runs October 1st to September 30th. We operate on a fiscal year basis. So our open enrollment is coming right up. In mid-August, we'll be distributing enrollment packets to all of our employees. You folks will get a packet as well, okay? Although you're selecting benefits now that will be effective September 1st, you'll also want to participate in our open enrollment for your benefit renewal that will occur on October 1st. Okay? We're not making any changes to plans, and if you don't go online and do an open enrollment after your initial enrollment, your benefits will still continue for those benefits that are allowed to be renewed like that. One thing, if you take out a medical spending account or a dependent care spending account, you'll want to be sure to go online and carry that over, because it won't carry over automatically. Your choices for medical, dental, vision, life insurances, those things would continue, and we're not making any changes with any carriers this year, so there's not going to be a great deal of change occurring during open enrollment. Okay? The IRS recognized status change just means that once you've made your benefit choices, they remain in effect for the entire fiscal year unless you have a qualifying event, such as, if you had a change from part-time to full-time or something like that that was work-related, I would be notifying you and letting you know that it was an opportunity to make changes to your benefits. If you have a qualifying event that's a life event, like if you got married, got divorced, if your spouse changed jobs, and that affected your benefits in some way, you'd want to contact me within 30 days of the event so that we could make changes to your benefit choices, okay, that are recognized by the IRS as a qualifying event. And deductions, as I said, are withheld 26 times per year, and we do provide online enrollment. The options for the medical insurance are either an HMO or a PPO plan. Both plans are provided by Blue Cross Blue Shield, and both plans include options for hospital services, physician services, and prescription drug coverage. We do have some additional benefits that we call in-house benefits, such as filling your prescriptions at our in-house pharmacy. The Blue Cross Blue Shield plans have a $100 deductible, but if you use our in-house pharmacy, there's no deductible on the prescription side, so that does save you that $100. Our co-pays for the 30-day supply of medications is also less than the standard retail pharmacy cost through Blue Cross, so it's another benefit to using our in-house pharmacy. On the PPO plan, that's the additional in-house benefit, okay, is the pharmacy. If you choose an HMO plan, you have some additional benefits provided through CVMC, such as a reduced copay. If you have an inpatient hospital admission, the copay is reduced by 50%. If you have an outpatient surgical procedure, the outpatient copayment is completely waived, so it doesn't cost you a $500 copay for an outpatient surgery. That would be on any services provided here at CVMC, okay? And some additional savings on rehabilitation and cardiac rehab. You would pay a $25 copayment initially, and then all the subsequent visits, the copay would be waived. So again, that's typically either a $25 or a $40 copay for each visit. So that's a significant savings for using CVMC facilities whenever you can. CVMC also pays 74% of the premium cost for part-time employees and 80% of the premium for full-time employees. We do extend coverage to civil union marriage and domestic partners who meet certain criteria, and we do provide an opt-out incentive for those employees who provide proof of other coverage. You'll find this opt-out waiver form in your packet. It's a paper form. When you go online, you will be waiving the benefit. You'll be checking the box to waive the benefit, but you'll also need to complete that paper form, make a photocopy of your other insurance card and attach it and send it to Human Resources. We don't have a method for you to complete the waiver online, okay? So that's one additional piece if you're not going to be taking our medical insurance. The opt-out incentive is explained on the waiver form. It tells you the amount that you receive, whether you're full-time or part-time, and whether you're taking a single plan, a two-person plan, or a family plan. We do offer medical independent care spending accounts, and deductions are made on a pre-tax basis to reimburse your out-of-pocket medical expenses and daycare expenses. They call it dependent care expenses. It's a little confusing to some people, but it's really eligible child care expenses. Your claims must be incurred during the plan year, and unused account balances are forfeited. So again, just keep in mind that this is on the, for the medical reimbursement, it's not an HSA. It's not, we don't have a high deductible health plan, so it's not a healthcare savings account. It's a reimbursement type flexible spending account where the claims have to be incurred during the plan year, and then you need to submit and receive your reimbursements before the end of the fiscal year period or the run-out period, which for our plan is December 31st, okay? You'd have to have all your claims in. Another little note for you folks who are coming in at this point, it would be wise to really think about enrolling in a medical spending account at open enrollment, which is the October 1st renewal date, versus September 1st, because if you're electing a medical or dependent care spending account for September 1st, you're really only electing what you will spend in that 1 month, the month of September. So you might want to hold off until the open enrollment piece before you enroll in one of those accounts, okay? The dental insurance is provided by Northeast Delta Dental. It's a $50 deductible for a single plan, $150 deductible for a family plan, 100% coverage for preventative care, and they do allow up to 4 cleanings per year. Basic restorative work is covered at 80% after the deductible. Major restorative and orthodontia is covered at 50% after the deductible and waiting periods. The plan has a $1,500 maximum per person per calendar year and a separate $1,500 lifetime limit on orthodontics. CVMC pays 50% of the premium for part-time employees, and they pay 65% of the premium cost for full-time employees. I know the slide says 60%, but we just upped that this year, and it is a 65% CVMC contribution. Keep in mind that the dental insurance does run calendar year, even though we operate on a fiscal year basis. When they talk about deductibles and plan year maximums, they're always talking about the calendar year. Okay, so if you meet your deductible in September, you're not going to have to meet it again starting in October. You won't have to meet it again until January. Okay? We also offer a plan called Vision Service Plan. This is a comprehensive vision plan that provides not only an exam but also glasses or contact lenses. You can get an exam and lenses covered annually. You can get a frame covered every other year, subject to the plan maximum, which currently the frame maximum is $140 allowance. The copay for an exam is $10, and copay on the materials is $25, and we also have some additional discounts that are available through the participating providers. Vision Service Plan does require that you use participating providers to get the best level of benefit, and you can find a list of those providers online. I'm not sure if it's in your packet because it has become quite an extensive list, takes up a lot of room in the packet, but it's available at Vision Service Plan online or on our intranet or our route directory. Keep in mind that on your medical insurance, you do have an annual eye exam, but it's just the eye exam. So if you have a Blue Cross plan, you can get an eye exam, but it won't cover anything for glasses. And for those folks who want the extra, more comprehensive plan, the Vision Service Plan is a way to do that. So we've talked about the medical, dental, vision, and spending accounts. We're going to shift gears a little bit now, and we're going to talk about disability, and the next slide is going to be the life insurance. CVMC considers disability insurance at the long-term disability level to be a core benefit, and CVMC does provide you with a credit equal to the cost of the standard long-term disability benefit, which is a 60% income replacement 180-day waiting period option. Okay, you'll receive a credit equal to the cost of that. So in that sense, there's no cost to you to have that insurance. Okay. The long-term disability options are a 90-day, 180-day, or 210-day plan. And you can choose any one of those 3 plans as long as you do elect one of them. The hospital pays for the core benefit, which is, again, the 60% 180-day option. If you choose to take a 90-day, 60% income replacement, then you will have to contribute a little bit to the cost. If you take a 40% 210-day elimination period, you'll be spending less than your credit, and you'll have a little credit money left over to offset another benefit cost. Okay? The long-term disability insurance is designed to be protection against catastrophic type disability because it does have a substantial waiting period. You know, it is considered a core benefit and you are required to enroll in one of the options. Your coverage cannot overlap with short-term disability, so if you find that long-term disability doesn't meet all of your disability needs and you're going to choose to purchase a short-term disability plan, just be sure that you're not buying a long-term disability plan that overlaps, okay? Short-term disability insurance is available to you. It is not considered a core benefit, but certainly a valuable benefit to a lot of employees who really want to have a more immediate income replacement. The waiting period for short-term disability is 1 week of disability, and then short-term disability benefits will continue for up to 26 weeks, provided you remain disabled for that entire time. And you have your choice of either a 50% or a 70% income replacement policy capped at $2,000 weekly. You will find the short-term disability options online, and it will tell you the exact amount of coverage that you're eligible for and the specific premium cost. The same with the long-term disability. You'll find the premium cost online because those benefit premiums are directly related to the volume of benefit provided, so they're not a flat premium cost. Okay? Life insurance is another core benefit, and CVMC provides you with a credit equal to the cost of a 100% employer-paid basic term life policy equal to 1.5 times your annual base salary. This coverage is voluntary, so you're not required to enroll in it, even though you are provided a credit equal to the cost of the basic policy. If you choose to take advantage of the basic policy, you're then eligible to buy additional amounts of life insurance up to 3 times your annual salary, and this is term life insurance. Should you enroll in the basic term life insurance, you're eligible not only to buy additional life insurance on your own life, but you're eligible to buy dependent life insurance on your spouse and or your children. Life insurance coverage over $50,000 is taxable, and because it's offered on a flex plan, we just need to make you aware of that if you're choosing a life insurance benefit that exceeds $50,000, there will be a small amount of imputed income tax that will be adjusted at the end of the year. It's not a significant amount of tax for folks who are buying, you know, typical amounts of life insurance, so it's certainly not a reason to choose not to buy the life insurance, but it does need to be disclosed to you. Keep in mind that since the life insurance is a voluntary benefit, there is something called guaranteed issue, and if you enroll in the life insurance at your first enrollment opportunity, which is now, the life insurance benefit is a guaranteed issue benefit, meaning that there's no health questionnaire, there's no physical that's going to be required or anything like that. It's guaranteed to be issued. If you decline the life insurance and want to buy it later, even if it's at an open enrollment period, you would have to satisfy what's called evidence of insurability. You would have to answer health questions, and you may have to submit to a physical examination. So I usually tell folks, you know, if you're uncertain about whether or not to take the life insurance, it's easier to take it now and drop it at a subsequent open enrollment than it is to pass it up now and then try to get it later, because sometimes you can be declined for life insurance. Some additional benefits that are available through CVMC are we do have an on-site credit union. We offer discount home and auto insurance through payroll deduction. We offer over-the-counter medications through a vending machine system, long-term care insurance, Vermont Higher Education Investment Plan, some fitness center discounts, tire store discounts, jury duty and funeral leave pay. We offer pet insurance, AFLAC, and of course the shift float call and unscheduled shift differentials. And the shift float call and unscheduled shift differentials are administered at your department level. So if you have questions about those, it's best to seek out your department manager and ask questions, because those do vary based on whether or not you work in a clinical area, and you know what is considered an unscheduled shift in one area might be different in another area. We offer an EAP program. It's called an Employee Assistance Program. It's available to all employees and their family members who reside in the household. Free short-term confidential counseling information and resources. This is just an example of some of the things that the EAP program assists with. We do have an EAP representative who comes on site, and I believe that she's here at least once a month to meet with employees. However, you do not need to wait for the EAP person to be on site. Employees can make contact with the EAP at any time on their own. The pamphlets are handed out in your packets. I know that they're available throughout the hospital as well. And this, again, is a completely free and very confidential employee assistance program. Combined time off, or CTO time, is available to full-time and part-time employees. It's used for vacation time, sick time, personal days, and holidays. At the full-time level, you will initially accrue 26 days off annually. After you've been here 5 years, in your 5th through 10th year, you will accrue an additional 5 days, bringing your total annual accrual to 31 days. And after 10 years, 1 additional day, 32 days. And finally, after 14 years, or if you're a department head or physician, you'll accrue at the highest level, which is 36 days annually. Part-time employees accrue prorated based on the number of hours you actually work. So, that means if you're a half-time employee working 40 hours, you will accrue 4 hours of paid time off each pay period instead of 8 hours. But you will accrue CTO time on additional days that you might be asked to work. So even though you may be hired into a 40-hour biweekly position, if you're asked to pick up an extra shift and you end up working a little more than your 40 hours, you will accrue CTO time on all the hours you work, up to 80. You're allowed to accrue up to 2 times your annual accrual rate and hold it in what's called your CTO bank. And you may also cash in CTO or use it toward your benefits annually. You also may donate CTO under our CTO donation program, which is for employees who may have exhausted all of their own CTO due to some catastrophic event. Usually it's a very serious medical condition or something like that, and employees can choose to donate hours to that coworker who's used up all of their own CTO time. The cash-in or using toward benefits. Using your CTO toward benefits is really helpful if you want to reduce your overall benefit cost, but the drawback is that you will accrue less time off. So I encourage people to talk with me about that and really understand it before you make the leap to enroll in a CTO contribution toward benefits. The cash-in is used after you've accumulated quite a bank of CTO time. So again, not typically something that new employees would be doing because you wouldn't have accumulated enough CTO to take advantage of that at this open enrollment. But it is offered during open enrollment, and we have twice a year that we allow the cash-in to be done. However, it does need to be pre-elected during the open enrollment season. Okay? And that concludes our Flex benefit presentation.